Welcome back YouTubers to my channel of an everyday life of an Aspie. If you're new, I welcome you all. I'm Aspie. I'm all about creating mental health awareness and sharing my life stories with Asperger's syndrome, as well as other hosts of mental health conditions, along with tips and advice, along with also taking you all on a journey what life is like for me. So if you're into any of these and more that are coming up in later today on my videos, smash the subscribe button on the bottom right hand corner if you would like to join me on the bandwagon as a family member, as well as in saying this to also turn on the notification bell so you don't miss any future videos like these or any future video updates. So we are talking about the drug type series. So as I said, there are 7 types. So this one's number 5, all about opioids. So as always, that at the end of the video there will be some contact information for people to reach out to here in New Zealand, because obviously, as you guys know, I'm a New Zealand YouTuber, and hopefully in saying this will bring support for you guys, for the ones that are worried about their partner or whoever it may be that is, you know, using to the point that it's causing harm to you and others around them as well. So let's begin this. The very first question, as always, what are opioids? Opioids are the drugs that act through the opioid receptors. Opioids are the most commonly used or prescribed medicines that are used worldwide and are commonly used to treat pains and coughs. These include drugs such as heroin, morphine, codeine, fentanyl, hydrocodone, oxycodone, methadone, and more. Opioids looks like chemicals in your brain and body that attach to tiny parts on your nerve cells called opioid receptors, hence the name opioid. Scientists have found 3 types of opioid receptors, which are your mu, delta, and kappa, named after the letters of the Greek alphabet. Each of these receptors play a different role, however. For example, mu receptors are responsible for opioids' pleasurable effects and their ability to relieve pain. Opioids act on many places in the brain and nervous system that will include the limbic system, which controls emotions. Here, opioids can create feelings of pleasure, relaxation, and contentment. The brainstem, which controls things your body does automatically, like breathing. Here, opioids can slow your breathing and stop you coughing and reduce the feelings of pain. The parts of the brain that are affected are the spinal cord, which receives sensations from the body before sending them back to the brain. Here too, opioids decrease feelings of pain, even after some serious injuries we have. Whether it is a medication like codeine or a straight drug like heroin, the effects of opioids and many other drugs depend on how much you take, as always, and how long you've been taking them and how you take them. If they're injected, they act faster and more intensely on the body. If opioids are swallowed as pills, however, they take longer to reach to the brain and are much more safer to use. However, to look out for, as we know, that most drugs are highly addictive once you start to consume them, or whatever way of method you're taking them, because obviously you'll be needing the next hit, the next high. As the body builds up that tolerance for the drug, more is needed to maintain that desired feeling or outcome of what you were looking for. Withdrawals can be long and physically painful, however. Combining opioids with alcohol and other drugs can lead to death from respiratory failure, relaxation, indifference to emotional or physical pain, drowsiness, constipation, slow breathing, and death. Opioid addiction is a chronic medical condition. It creates changes in your brain that make you more likely to get addicted. It takes much more than willpower to break free from prescription drug abuse, however, but you can escape the cycle of detox and relapse. It may be a long-term process, but with the right medications and counselling, this can improve your chances of success if you're willing to by choice. Physical dependence and detox. Opioid addiction leads to real changes in certain areas of your brain, as mentioned. Prescription drugs addiction alters the circuits of the brain that are responsible for mood and reward behavior. In addition, long-term prescription drug abuse, however, affects almost all of your body systems. When you cut off the opioid supply, however, and go cold turkey, as they call it, you're likely to get withdrawal symptoms such as craving for drugs, diarrhea, large pupils, yawning, belly aches and pains, chills and goosebumps, hence the original name that came from cold turkey, vomiting, nausea, body aches, agitation, and severe bad moods. If you already have a narcotic addiction, you'll know that a list of these symptoms doesn't capture the agony of going through them. It's extremely unpleasant and you'll do almost anything to avoid it. Withdrawals will last from hours to several days, depending on the type of drug that you are using in this class drug, and sometimes even weeks. It depends on which drug you were taking, how long you were taking it, and how much in the dosage. Of the intense initial symptoms that I've mentioned clearly will subside, some physical and mental disorders may linger for weeks on end. How long does some of these last in the body of the opioids? I'm listing two, which are the most common ones, which more in depth of these ones later, which is your heroin. Heroin lasts at least 3 to 4 days in your urine and up to 12 hours in your bloodstream. And on the other hand, morphine is 2 to 3 days in your urine and 6 to 8 hours in your blood. Like any treatments, medications, the unpleasantness is a major reason for relapse and continued prescription drug abuse. But there are medications out there that can help you through opioid withdrawal symptoms and prevent these symptoms from occurring time and time again. After the initial detox, you're at risk of a relapse. Experts say psychological and social factors are the main drivers that could push the person who was using back to using. Stress in situations that remind your brain of the pleasure the drug can bring more common triggers or so. Successful lifelong therapy to stay opioid free usually involves long-term medication with counselling and talk therapy programs available in your area. Methadone or methadone is a long-acting opioid that affects the same parts of your brain as the drug you're having a problem with does. But it doesn't get you high though, like most common ones like your heroin and morphine. You can take it every day, but you have to go to a special clinic to get it. The correct dose prevents withdrawal symptoms and eases drug cravings. Buprenorphine is a shorter acting drug than methadone. It hits the same receptors in the brain, but not as strongly. It has less chance or risk of lethal overdose, so it's often favored for treatment. It's also available in combination with naloxone. It comes in several forms of these opioids, like I said, tablet forms such as Suboxone, Zubsolv, or as a shot with a syringe, which is your buprenorphine, film placed in your mouth against your cheek, which is Belbuca, skin patches, Butrans, implant that goes under your skin and lasts for 6 months are labelled as your probuphine. Naltrexone also blocks opiate receptors. Unlike methadone, however, it can ease withdrawal symptoms or even your cravings. But you can't get high if you use drugs while taking it. Naltrexone works best as your part of your broad recovery program. You'll start it when you're done with detox. You can take it by mouth, which is called Revere, by injection, which is your Vivitrol, lofexidine hydrochloride, Lucimira. Isn't an opioid, but it can be used to ease the symptoms when there needs to be a rapid detoxification. It's most often used with either. It's been approved for use up to 14 days. Completing detox subdues effects of narcotic addiction and opioid withdrawal, but when cravings strikes, however, they're hard to resist. If you go through detox and short-term counselling without maintenance treatment, you're most likely to relapse to the prescription drug abuse. Your chances of beating narcotic addiction are better with long-term maintenance therapy that includes drugs along with some form of talk therapy, as I clearly mentioned earlier. So this quickly ends a quick video of opioids. For the ones that have maybe tried some of these drugs, what was your reasons for it, and also in saying this, doing this, how did you overcome this if you made the choice of staying sober from these form of drugs, and what was it like for you, Hearsay, and what would you like to give as a message to others around you if you have survived the abuse? So don't forget to smash the like, comment below, feel free to share these videos around, feel free to follow me on my social medias, on my Twitter, Facebook and whatnot that's listed below, and also below there'll be a link for my online store, because obviously at this point of time my online store is up and running, and for this month only 15% off items. And in saying this, I'm thinking on changing it up for maybe something later on that someone suggested to me. If guys aren't interested with a girl, you know, avatar representing me, you know, that's fine. I'll figure that out along the way. So without further ado, guys, please support, thanks for watching, do what love you do, and I'll catch you soon.